Hi there, I'm Dr. Phelan. Welcome to this new video. Today I'm going to create a new video from my webinar questions answered series. And today's video is from my vertical dimension case studies webinar. So it's videoseminar.com. And this question comes from Dr. Alvarado. And Dr. Alvarado is asking, do these patients, the patients that we're showing in the case study that we altered the vertical dimension for, do these patients experience TMJ pain after you've altered the vertical dimension? And I can clearly state that no, none of those patients experienced TMJ pain after we altered their vertical dimension. In fact, I have no patients, knock on wood, that I am aware of, and I'm quite sure I would be aware because they would tell me, I have no patients that I'm aware of that had TMJ pain after altering the vertical dimension, at least not immediately, and I can't think of any long-term ones. And you know, there's a good reason for this, and the reason for this is that we're building the cases on the articulator, so we're building them at a very predictable designed vertical position. If you watch the webinar, you'll see we're using the PIC, point of initial contact, as a way to evaluate the vertical that we're going to build the cases to. So we're using the leaf gauge to take a CR bite at an open vertical and evaluating the cases when we close that down to the point of initial contact with the models mounted in CR. Now, when I'm doing that CR bite with the leaf gauge at the open vertical, if the patient has a joint problem, I would know then because we load test the joint, and we also, I Doppler the joint also and palpate the joint, but the load testing is the one that really tells us if the patient cannot accept load with their joint, they're having pain, we don't proceed to the next step. We don't do the rehab if we can't deprogram the patient and have the pain go away if it's muscle pain. If it's joint pain, actual internal joint problems for this patient, we don't proceed to the next step. So I believe that that's one of the big reasons why I don't have these joint problems with these patients, because I'm starting with patients with relatively healthy joints. I'm not excluding patients if they have a click that doesn't have pain. So if they have a click with a lot of pain, so if they're clicking off the disc and getting back on the disc, but when they click off the disc, they're having a lot of pain, they're being pushed into the retrodiscal tissue and it's painful. So if the whole disc is coming off and the condyl's going into the retrodiscal tissue and they're having a lot of pain, I don't treat them at that point of time. We would do splint therapy or send them to a TMJ office and wait until they have no pain with clicking that we would treat them and alter their vertical. So we're careful about patient selection. I think that helps. And I wouldn't say, I think that the question Dr. Alvarado's wondering is, does doing this cause the patient to have joint problems? And I would say definitely not if you follow the system in the vertical dimension case studies webinar, because we're opening the vertical dimension but in the condylar axis of CR. So what if the patient has a click that's not painful? We've treated those patients. Generally, I can say again, doesn't get worse, doesn't get more painful. In fact, I had one patient, very deep overbite, lots of tooth wear, had a click. We decided to deprogram her with a Koi's deprogrammer, and the click was better with the deprogrammer. So we then went and started the rehab, and the rehab didn't open her quite as much as the deprogrammer did. And the click was back, and it was moderately bad click. But I remembered that with the deprogrammer in, she didn't have as bad a click. In fact, it was gone temporarily while she was wearing the deprogrammer. If she took it out, it came back. So what we decided to do was redo the provisionals, because we're testing this new vertical in provisionals. We decided to redo the provisionals at the vertical dimension, opening her to the vertical dimension we opened her with the deprogrammer, and boom, click was gone. Didn't come back because we're holding her that far open with the provisionals. So that in fact was interesting. So we tested this for 3 months before I went to finished restorations. And then I tested it again with one arch finished at that vertical against the other provisional arch. And so we tested this pretty extensively. Never did the click come back, and the patient felt better because the click was moderately severe. Didn't really hurt, but it was like click and like pretty, you could hear it, audibly hear it. I actually recorded it with one of my video cameras. I should dig it up and play it during one of my members' monthly webinars. But that was interesting because changing the vertical dimension actually helped that patient's click, because I guess it it took some of the load off the joint and relaxed the lateral pterygoid muscle, so it wasn't pulling the disc forward and clicking her on and off. So it was kind of nice. So again, to answer Dr. Alvarado's question, I'd say no, we don't experience pain in the joint, but I believe a lot of this is case selection. And a lot of this is the technique that we use, opening the patient, using PIC as a reference, and seating the condyle into CR. So hopefully that helps. I hope you enjoyed that little discussion about this question. I thought it was an interesting question, and I thought it was a better one to speak about on video as opposed to write a written email about this. And basically that's it. If you're interested in attending this webinar, it's videoseminar.com. That's videoseminar.com. I'll put a link to the webinar below this video. So thank you very much, and we'll talk to you soon. Take care.